ranking member, and important discussion and a serious one. And I appreciate the insights and the time and commitment by the witnesses. I'm also want to say it's an honor to serve as co-chair with Terry Sewell and the other members on this rural task force, where we are trying to solve some of the structural challenges to access to rural for folks living in rural America, and making some of these policy changes that have been made in the interim permanent, where they're making a difference and creating that access. In this case, and I appreciate everybody, but Dr. Hildreth, I really was impressed with the consortium and your efforts in your community to tackle the challenges. COVID has definitely revealed problems that pre-existed, but are highlighting them. And it seems like you took charge there with your communities and your medical school. And I appreciate that. But as I listen to and study this disparate outcomes in health and the underlying issues of comorbidities and higher exposure to the virus in certain jobs, and certain jobs being more vulnerable to being cut, people living in densely populated areas, et cetera, et cetera. It seems like a lot of these factors are really affecting a broader group of people than just based on race and ethnicity. It's people in poverty. It's people that are struggling to survive. It doesn't matter whether you're Black or white or Hispanic. This is about underserved areas and economically disadvantaged peoples. Now, granted, in the African-American community in this 2018 census, 21% are living in poverty as opposed to 10% of white Americans, and Hispanic at 18%. And so we certainly need to discuss the issues of why the higher rates, but this issue of health disparities is affecting people of all colors and ethnicities. Would you agree with that? And that seems to be the framing that would incorporate really more of an all-American approach to this inequity. Any comments on that?
Congressman Arrington, I totally agree with you. The virus is agnostic to race, to gender, how much money you make. If you have an ACE protein in your body, which we all do, the virus can infect you. The problem is that while we're all equally susceptible to the virus, we're not equally susceptible to the effects of the virus. The approach that we've taken in this country so far is a population-based approach in which we try to reduce the average risk for everybody. That assumes that all of us are in equal risk of the virus, but unfortunately that's not the case. So the time has come to pivot from a population-based approach to a more targeted approach, which means let's try to protect those who are most vulnerable. And I agree with you. Rural communities where you have both white people and Black people have higher burdens of these comorbidities, and they're going to die equally, whether they're Black or white. So I totally agree with you. And all I'm advocating for is that for vulnerable populations, let's do what we can to keep them from getting infected, because we don't have a vaccine, we don't have a drug. The best strategy we have is to keep those communities protected. And I totally agree with you. This transcends race, age, all those things. And so I'm with you. I totally agree.
Well, I appreciate that. And I think, and I agree with you and the others, we need to prioritize vulnerable peoples of all kinds, and we need to make sure they have the tools and resources, whether they're urban, rural, Black or white, Hispanic,